This is Dr. Alkhalili, or Dr. A. I'm here to talk about Scarless robotic thyroid surgery. Specifically, I'm interested in talking about some myths that I've heard from my own patients, from even clinicians who refer patients to us. So I decided to go with these top 5 myths that I've heard over and over again. And I would just like to go over them to make sure that you have the best understanding possible about robotic Scarless thyroid surgery. Okay, so myth number 1 is that the incision for Scarless robotic thyroid surgery is a lot bigger than traditional surgery. That's actually not true at all. So for me, in my practice, the size of the incision for the transaxillary robotic thyroid surgery is 3.5 to 4 centimeters. So that's yay big. That's actually half the size of a traditional thyroid incision. It stems from the fact that in the old days, when we used to have old robots that were very large, very bulky, we needed to make bigger incision to accommodate those robots. But today, my robot is, with all of its eyes and arms, is only 2.5 centimeters in size. This big. So, which means that I am able to make very small incisions that you can barely see to perform Scarless thyroid surgery. And that leads us to myth number 2, which is the robot is actually doing the surgery. So I've heard this from multiple patients where they actually worried about who's performing the surgery, whether it be myself or the robot. And I'm here to tell you that the robot doesn't do anything on its own. It doesn't have any independent function. It has no AI capabilities. It doesn't even learn anything. The robot is mostly an instrument, and it mirrors every move that I do outside the body, inside the body. So think of it less of an actual robot walking around and more of just a simple instrument that I am using to perform the operation. That leads to the question, well, then why are you using the robot to do the surgery? It's because the robotic arms are 6 millimeters each, this big. As you can see, my hands are very big, so I'm not going to be able to reach the thyroid from the axilla with a small incision using my hands. This is where the robot becomes very, very helpful because of its tiny, tiny arms, very long, that allows me to reach the thyroid through an axillary incision and perform the operation. Myth number 3 is one that I've actually heard from patients as well as providers. And that is, my nodule or my patient's nodule is too big to perform Scarless robotic thyroid surgery. And I'm going to tell you a small story about a patient who came to see us from Texas, and her endocrinologist told her that because her nodule was about 4 centimeters in size, that she was not a candidate for robotic Scarless thyroid surgery. And when the patient arrived here, I told her that that's not necessarily true, and we performed the operation and she did very, very well. And that leads me to tell you that a single dimension, a single measurement of a thyroid nodule does not mean that you cannot get robotic surgery. So when I look at the nodule or the thyroid overall, I look at the entire thyroid gland and the patient as well to be able to determine if technically a robotic Scarless thyroid surgery would be possible or not. And that doesn't necessarily rely on the single number of the largest dimension of the nodule. Myth number 4 is that Scarless robotic thyroid surgery cannot be performed to treat thyroid cancer. This is a bit tricky, but the short answer is that is not true. That is a myth. We are able to use the robot and perform a Scarless approach for the vast majority of thyroid cancers. It's only in the cases where the cancer is very advanced or very aggressive subtype of thyroid cancer that we're not able to use the robot for technical reasons. But for over 90% of cases of thyroid cancer, we are able to perform the operation in a Scarless approach with the help of the robot. Myth number 5 is that Scarless and robotic thyroid surgery is associated with an increased risk of complications. And that is not true. Again, we've had lots and lots of body of evidence and clinical studies to show that the robotic and Scarless thyroid surgical approach is both safe and effective. So when we talk about the possible risks from the injury to the nerve that supplies the vocal cords causing hoarseness, to injury to the parathyroid glands that help control the level of calcium in the blood, none of these complications has been shown to be increased in Scarless robotic thyroid surgery. So the short answer to that is no, there is not an increased risk of complications with Scarless on robotic thyroid surgery. The last myth we're gonna bust today is that Scarless robotic thyroid surgery is associated with a prolonged recovery, meaning longer recovery time than the traditional surgery. And that's simply not true. In fact, most of my patients have less physical activity and weightlifting restrictions than the traditional surgery. And because the incision is smaller, typically it's not associated with any increased level of pain than the traditional surgery. So the short answer is no, it's not. It's actually in fact shown to be as effective, if not more effective than traditional surgery when it comes to getting you back on your feet and recovering from the surgery. I hope you found this video helpful. So if you or your loved ones need thyroid care, please make sure to visit us at thyroidcancer.com, and hopefully I'll get to see you soon in Tampa. Thank you.